Hi everyone, Assalamualaikum. So today we are going to learn about sensory processing disorder, or we call it as SPD. So let's learn more in the next slide. Alright. So SPD is a condition where the brain has difficulty receiving and responding to information that comes through the senses. So this can affect how someone responds to stimuli such as touch, sound, sight, and movement. Okay, so individual with SPD may be oversensitive or undersensitive to sensory input, leading to challenges in daily activities and interactions. So it's often associated with other developmental disorder, but it can also occur on its own. So the treatment approaches may include sensory integration, therapy, and other intervention aimed to help individual to better process and respond to sensory stimuli. Okay, so there are three types of sensory processing disorder. The first one is sensory over-responsivity, sensitivities, or we call it as sensory defensiveness. So people with sensory over-responsivity are overly sensitive to sensory stimuli and lead to highly react, such as avoiding certain texture or sound or even light. All right, the second one is sensory under responsivity. So, sensory under responsivity involve decreased responsiveness to sensory input and prompting individual to seek more intense stimulation to feel and respond to their environment. And lastly, we have sensory seeking and craving. So, individuals actively seek out intense sensory experience, often engaging in repetitive behavior to fulfill their sensory needs. So the sign and symptom of SPD include highly sensitivity to sound, texture, or light, avoidance of certain clothing due to discomfort, difficulty tolerating certain food texture, fidgeting, or constant movement to seek sensory input, and challenges with coordination or balance. So most of the sign and symptom of SPD is related to our sensory that include tactile sensitivity, auditory sensitivity, visual sensitivity, olfactory sensitivity, gustatory sensitivity, and vestibular sensitivity, and lastly propriosensitivity. So, it is crucial to note that individuals with SPD may experience all of these signs and symptoms, but it can be different from each person. So, this sensitivity can impact various aspects of daily life, influencing behavior, emotion, and overall well being. So, please seek for professional evaluation and support to if you have this kind of symptom. So the causes of sensory processing disorder are not fully understood yet, but there are several factors that may contribute, which include these three main causes. The first one is genetic predisposition. So this appear to be a genetic component, suggesting that SPD may run in families. So, individual with a family history of sensory sensitivity may be more likely to experience SPD. The second one is a neurological factor. So differences in brain structure or function, particularly in areas responsible for processing sensory information, could contribute to SPD. So research is ongoing to better understand this neurological aspect. And lastly, premature birth or complication. So some studies suggest a correlation between preterm birth or complication during birth and the development of sensory processing challenges. So these early stages of brain development may be influenced by this factor. There are also other contributing factors such as environmental factor and other developmental conditions. So it is important to note that SPD is likely a result of combination of these factors, and this specific cause can vary from person to person. So the treatment approaches for person with SPD are including these four suggestions. The first one is sensory integration therapy. So this type of therapy focuses on exposing individual to sensory stimuli in a structured or repetitive manner to help the brain adapt and respond more effectively over time. So the second one is occupational therapy or OT. So OT specialized in sensory integration play a central role. They design personalized intervention to address specific sensory challenges, and this may involve activity that provide controlled sensory input, gradually help individuals adapt with different stimuli. The third one is behavioral interventions. So, targeted strategies can help individuals cope with challenges related to SPD. So, they may include the teaching self regulation technique, communication skill, and coping mechanism for sensory discomfort. Lastly, uh, individual with SPD may also try to collaborate approaches that involve parents, teachers, and therapists. So, in summary, SPD is a complex condition influenced by genetic, neurological, and environmental factors, and it manifests in various types and each presenting unique challenges. So, early identification and intervention often involve occupational therapy are crucial. Living with SPD involves navigating highly sensitive and support from family, educators, and healthcare professionals is essential. Despite these challenges, individuals with SPD contribute unique strength, and it is better to increase awareness and ongoing research contribute to better understanding of SPD and fostering more inclusive environment and improve quality of life for those affected. So I think that's all for this presentation. I hope you all understand this SPD. That's all from me. Thank you. Assalamualaikum.